I said, most likely.
Most likely.
You want to be a plastic surgeon, cosmetic surgeon? Okay, fine, you will do it. I said, okay, fine, in your honor, I'll demonstrate it for you. Most times you'll need just the basic suturing techniques, which you will be taught in metaphor anyway. Of course, now also you've learned the same things. So basically, subcuticular suturing is used when we're doing a cosmetic thing, job on the face or something. For a young lady who's very beautiful, you don't want to have any scar, so you want to do that, right? So you don't leave any external marks. So the principle of doing the subcuticular suturing is, just imagine this is the thickness of the skin. So this is the epidermis, the black line that you see here is the epidermis, and the portion under that is the dermis. Subcuticular means there will be no sutures outside the epidermis. Everything is going to be within the dermis, just under the epidermis. It's so fine. So what we do is, in a normal person, suppose this is the suture line. We first take a bite full thickness like this, and we just come out. Just like that. That's the first step. Now my suture material is inside. I pull it out to a considerable extent and just leave a little bit here. Okay, now starts the main thing. You don't have to hold it. Now follow where exactly we have to take the bite. That is where the whole thing comes. I have to lift up one end completely like this, and I have to take a bite through the dermis. Just watch very carefully. It has to come out, not even through the epidermis, it has to come through the dermis. See? Mm-hmm. One side. It is a very fine, it's a little tedious also. It's not something that you can do very quickly and pull it out. Make sure this loop does not get inside. Now I'm still inside. Okay, now I've taken that side. Then I'll do the same on this side. Lift this up. That's why I said sometimes it tears. This is not actual skin. Again, go through, and come out through the dermis. So did you see? First I went through the dermis from that side, and then I came back and I went through the dermis from this side. And when I pull the two together, oh, see what has happened? This is exactly what I was afraid. That side is cut out. It came out. Mm-hmm. Because this is not the actual skin. In actual skin, the dermis is quite tough. It's got collagen tissue. So I'll have to take it again from that side. It tore off. I mean, the suture line just came out. So I'll have to take it again from that side. While I'm taking it, I hope this one does not come off. That was what I was worried about, because this is not the actual skin. So I have to do the same thing again here. Go through and come out from the dermis. Now when I pull it, you will see that the both of them will come together, but nothing has come outside. So that is the principle of subcuticular. I'm going to take a few more series now. See, they've come together, but nothing has come outside. It's all under the epidermis. That's why it is called subcuticular. Cuticle in this case refers to the epidermis. I'm going to take one more or two more. Again, I'm going to repeat. Let's start with this side. Go through the full thickness of the epidermis only and come out the dermis. Side done. Let me take the other side. Again, full thickness, epidermis, and here. in this. You can see that the skin edges are coming, but the epidermis is not being penetrated by my needle. They've come together. Now I'll take a few more.
And you said this would reduce scarring?
Because the suture is not penetrating through the epidermis. So it does not leave any, it leaves a very hairline scar. Again, I'm going to take just the epidermis, very close to the epidermis, but under it. And I'm going to take it out again. Yes. There you go. You have to keep tightening it so that the edges keep coming together. And then I'll go to the other side, do the same thing. Pick up. It should not come out from the epidermis. If it comes, you just take it back again. There. I'm just under the epidermis. Again, pull. See? Now you can see just the entire suture line is entirely under. Nothing has come out. I'm going to go a little more. So you just keep following. It'll take a little practice, but you can do it. Again, pick up the side. Make sure you get a good grip. Go under the epidermis. What we do is usually tell the assistant to just hold it lightly and keep it out of my way, so that it does not keep coming in the way. So you don't pull it hard, just gently out of the way, just enough to keep it out of my way, so that I can pick up the other side and I can take my next bite. So we keep doing like this, and finally when we have ended, I don't know, I think I have time, so let me show you how to end it. That end part is a little tricky. Let me go to the full extent. Again, hold it, keep it out of my way. Pull it so that it again comes. You can see that in all places, if you just give a little direction, just the epidermis is coming, and they will heal. Aim is to, if you don't penetrate through the epidermis, the scarring will be minimum. Again, we hold it for a minute. Just gently, enough to keep it out of my way. Have you noticed exactly where the needle is going in and coming out? It is never coming out. It's always remaining within the thickness of the skin. That is the key part. That is why it is called subcuticular stage. This is how it should be, so that it does not kink inside. See, when I pull it, they just come together. I'll just finish off, and then I'll show you how to end the whole thing. There are two ways of doing it, how to end it. I'll show you one which is a little tricky.
So your overall effect is very much of a weave coming together.
Yes,
almost like
I'm going like
sneakers.
this, like this, like this, like this. You know, it is like a horizontal continuous mattress, but all of it is under the skin, under the epidermis. Basically, that is the principle. There.
Well, I haven't been here for any of the meetings yet, so this is the first
Oh,
one
you have
I'm
not.
seeing.
You have not seen the first.
Yeah,
the simple
this is the
suturings?
first time I've seen.
Oh, you've seen the most difficult one, the last
Yes.
day. But anyway, when you come to Med 4, I won't be teaching you this. This is only a special one which I'm doing. We'll be demonstrating only the basic ones, the 4 basic ones, which you'll be needing most of your time. So here I'm using a 4-0 suture material. In actual practice, if you want to give an even fine hairline scar, you will use a 6-0, 7-0, even 8-0. For cornea, we use a 10-0. You can imagine how thin that is. It is thinner than your hair. And we use an operating microscope to do that.
So it's like
10
spider web.
10-0 is so thin that you can't see it. You can handle it with your bare eye.
And that's the one that dissolved?
That is the one which is used for cornea, for corneoscleral junction after cataract surgery or something. But nowadays, of course, there are many other ways of doing it also. If by chance you find the needle tip coming out through the epidermis, take it out and reinsert it again. Just keep giving gentle traction. Can you see the edges have just come together? And in no place is the suture line visible. It's all inside. But these sutures are removable. They are not absorbable, remember. And how to remove it also I'll show you. After, they can be kept for up to 4 weeks. 3 weeks, 4 weeks. So usually these patients are asked to come many weeks later. And then I'll tell you the technique of how to remove it. Because obviously you cannot go inside and cut them out, right? So there have to be a different way of removing them. I'm about to reach my end. I'll show you the technique of finishing it off, and I'm going to show you the technique how to remove it at a later date. But usually, unlike other sutures, which you remove after 7 days, in the face we remove after 5 days, but these are removed after 2 weeks, 3 weeks, or even 4 weeks. Okay, I'm almost reaching the end. Can you see? When this heals, this will leave a hairline scar because there's nothing outside. This is the true subcuticular stitch that you're seeing.
Now, would any of the bunching up as well, like there and there?
A little bit will be there, but if there's a little bit of gap, you can just put a steady strip across. Just 1 or 2, if there is. After some time, but even that will not matter, because what will happen is, and you learn about in pathology how healing takes place. A thin film of coagulum will form, and a small scab will form, and the epidermis will grow under it, and it will be almost a hairline scar. It will be nothing visible. You know, many of the messes that we surgeons make, the body takes care of itself. So we take the credit for that. So that's how it works. We know that the body will heal itself.
So Dr. Sanyal, like when do they use a dissolvable stitch?
Usually use it inside the body when you're not going to remove it.
Oh, so you wouldn't use it for anything like for cornea or?
Usually if it's outside, then we use it removable. This dissolvable, we use it in the fat, for example, subcutaneous fat. We use it in the peritoneum. We use it in the linea alba. Then not linea alba, we use non-absorbable for the intestine and all these places, for various places where you're not going to go inside and remove it again. Okay, I'm almost finishing, so let me just take the last bite and then I'll show you how to finish it. Last bite has to be a little tricky here. Let me see it. Okay. wherever if you see a little gap, you can just put a steri strip across. So I have done subcuticular. Now I'm going to end this. Just like I went in, now I'm going to come out. Because remember, I'm still inside. I'm under the epidermis.
Mm-hmm.
So what I do is I go again back in with my needle tip and just poke it out like this. Now I'm officially out. Till now I was inside the wound, now I'm officially out of the wound. And once I've done that, I pull it out completely, so now I've come completely out of the wound. And then I can't even see properly. And did you see what I did? I tied the knot on itself. Okay, I'll do it again. Make a loop, catch hold of the tip of any one part and pull it out from here like this. There. This is tying a knot on itself so that it will not come out. And then you cut this off. Similarly, this end also, you tie a knot on itself. Only thing is I made this too small, so I can't do it, but it doesn't matter. So this is how you finish it off. You tie a knot on itself and then we cut this off. Okay, so we leave this, and as I said, after you have done it, you inspect it. You find that in places it's united, in some places there are small gaps. It will be like that. Some places you may have gone a little deeper, some places you didn't go so deep. So in those places you can just put one steri strip here, one steri strip here, one steri strip here. That's all you need to do. Let's say the patient comes to you again after 3 weeks or 4 weeks. What you do is, if there is any knot this side or that side, just cut off the knot and then catch hold of one end, preferably with an artery forceps or something, and loop it around and pull gently like this in one axis.
And it should slowly wiggle itself out.
It'll just come out straight away because the top and the epidermis is completely healed, and it'll slowly come out. The thing is, I hope it doesn't tear. You keep pulling, it'll keep coming out.
But you already not.
I was going to say,
If you have knotted it, then you cut the knot.
yeah, you cut the knot on one side.
And you just keep gently pulling in one axis, and it'll keep coming. It should keep coming out.
What happens if it rips?
It should not. So you just
Shouldn't? Okay.
keep pulling, and it'll
I was
keep
gonna
coming.
say, our
Normally,
material is ripping though here,
here
because you notice we've had no movement
Yes,
here,
yes.
so it's just shredding inside.
it's just tightening up. But in actual practice, what would have happened is this would have healed completely,
Right.
and you'll find that the thing comes out much more easily.
Just slip right out.
It just comes out because the fibrous tissue has healed the thing, and it'll come out. You just keep pulling, and you find it slowly it just slides out. That is the way to do it. So this is the technique for subcuticular suturing.